Jaundice. Ayurvedic aspect about jaundice. Jaundice is a medical condition characterized by the yellowing of the skin, mucous membranes, and the whites of the eyes. This yellowish discoloration occurs when there is an excessive bilirubin in the body. Bilirubin is a yellow pigment produced during the breakdown of red blood cells, and it is normally processed by the liver and excreted in bile. When there is an issue with bilirubin metabolism, it can accumulate in the body, leading to jaundice. Here is a detailed description of jaundice. Causes of jaundice. Jaundice can have various underlying causes, and it can be classified into different types based on these causes. Hemolytic jaundice. This type is characterized by an increased breakdown of red blood cells, hemolysis, leading to elevated bilirubin levels. Conditions such as hemolytic anemia, certain genetic disorders, or incompatible blood transfusions can cause hemolytic jaundice. Hepatocellular jaundice. This type of jaundice is the result of liver diseases or conditions that affect the liver's ability to process bilirubin. Liver conditions like hepatitis, cirrhosis, or drug-induced liver injury can lead to hepatocellular jaundice. Obstructive jaundice. Obstructive jaundice occurs when there is a blockage in the bile ducts, preventing the normal flow of bile and bilirubin from the liver to the intestines. This can be due to conditions such as gallstones, pancreatic cancer, or strictures in the bile ducts. Symptoms of jaundice. The primary and most noticeable symptom of jaundice is the yellowing of the skin, eyes, and mucous membranes. However, other symptoms can vary depending on the underlying cause and may include fatigue, abdominal pain or discomfort, dark urine, pale-colored stools, itchy skin, pruritus, nausea and vomiting, weight loss. Diagnosis. Jaundice is diagnosed through a combination of physical examination, blood tests, and potentially imaging studies. Blood tests measure the levels of bilirubin in the blood and help determine the type and cause of jaundice. Imaging studies such as ultrasound, MRI, or CT scans may be used to identify any structural issues in the liver or bile ducts. Treatment of jaundice. The treatment of jaundice is directed at the underlying cause. Depending on the specific diagnosis, treatment options may include managing conditions leading to excessive bilirubin production, treating liver diseases or liver conditions, removing obstructions in the bile ducts through procedures or surgery. In severe cases of jaundice, particularly when associated with liver failure, hospitalization may be required for close monitoring and supportive care, including intravenous fluids and other treatments. Prognosis. The outlook for individuals with jaundice varies depending on the underlying cause and its severity. Some cases of jaundice are reversible with treatment, while others may necessitate ongoing management of the underlying condition. Early diagnosis and prompt treatment are essential to address the root cause of jaundice and manage it effectively. Prevention. Preventing jaundice often involves addressing factors that can lead to excessive bilirubin production, liver disease, or bile duct obstruction. This may include vaccination against hepatitis, managing underlying medical conditions like hemolytic disorders or liver diseases, maintaining a healthy lifestyle, including a balanced diet and avoiding excessive alcohol consumption. In summary, jaundice is a visible sign of an underlying issue with bilirubin metabolism in the body, which can have various causes. It is essential to consult a healthcare provider for an accurate diagnosis and appropriate treatment when jaundice is suspected, as timely intervention can greatly impact the outcome and recovery from the condition. In Ayurveda, jaundice is known as Kamala or Panduroga, and it is considered a disorder of the liver, primarily involving an imbalance in the Pitta dosha. Ayurveda offers a holistic approach to understanding and managing jaundice, focusing on rebalancing the doshas and improving overall liver function. Here is an Ayurvedic perspective on jaundice. Pitta imbalance. Ayurveda attributes jaundice to an aggravation of the Pitta dosha, which represents the fire element in the body. An increase in Pitta can lead to liver dysfunction and improper processing of bilirubin, resulting in jaundices. Characteristic yellowing of the skin and eyes. Causes. Ayurveda identifies various factors that can lead to Pitta aggravation and the development of jaundice, including excessive consumption of hot, spicy, and oily foods, alcohol, or exposure to toxins. Symptoms. Ayurvedic texts describe common symptoms of jaundice, which may include yellowing of the skin, eyes, and urine, along with fever, nausea, vomiting, fatigue, and a bitter taste in the mouth. Ayurvedic treatment approach. Ayurvedic treatment for jaundice aims to balance the aggravated Pitta dosha, detoxify the liver, and promote the elimination of excess bilirubin from the body. The following therapeutic approaches are commonly used. Dietary modifications. The Ayurvedic diet for jaundice often includes cooling and soothing foods to reduce Pitta, such as rice, barley, cooked vegetables, and fruits like pomegranates and bananas. Spicy, oily, and fried foods are typically avoided. Herbal remedies. Ayurvedic practitioners may prescribe specific herbs and herbal formulations known for their liver protective and detoxifying properties. Common herbs include Kutki, Amla, and Pinarnava. Detoxification. Panchakarma. Panchakarma treatments like Virachana, therapeutic purgation, or medicated enema may be recommended to cleanse the body of toxins and excess Pitta. Lifestyle adjustments. Ayurvedic guidelines often include lifestyle modifications such as stress reduction, adequate rest, and avoidance of excessive heat or sun exposure. Home remedies. Certain home remedies like drinking sugarcane juice, consuming radish leaves or juice, or taking a mixture of turmeric and honey are considered beneficial. Prevention. Ayurveda emphasizes the importance of maintaining a balanced lifestyle and dietary habits to prevent conditions like jaundice. This includes practicing good hygiene, consuming a balanced diet, and avoiding excessive alcohol and spicy foods. It's important to consult with a qualified Ayurvedic practitioner for an accurate diagnosis and an individualized treatment plan for jaundice. Ayurvedic treatments should be integrated into a comprehensive plan under the guidance of healthcare providers for appropriate medical care and monitoring of the condition. Always follow the recommendations of healthcare professionals for the most effective treatment and management of jaundice. Thank you for watching my video. Subscribe channel, like and share.